seats so that we can start with the next bit of the program. Okay, the people in the back, you're having way too much fun. Come to the front, pick a seat, because we're starting with the second plenary session for today already. It is a good sign, though, that you're still chatting up. I hope it's about your parallel sessions and not about your weekend plans, folks. It better be. Well, I will find out, believe me. Okay, I hope you enjoyed your parallel sessions. Can I see hands who learned something new in their session? Can I see some hands up in the air? Okay. Oh, that's a lot of hands. That's a good sign. Who, by the way, this is also an important one. Who had time to take a look at the posters during the coffee break? Can I see some other hands? Okay, we love to see it. For those of you that didn't, make sure to still check them out. You can do so. They're still in the hallway. And then make sure to vote for your favorite poster through Slido. As I said, the winner of this specific category group of today will be one of the pitches that we'll see in the program tomorrow. So you have power, folks, to decide the conversation. Use it. To those of you that haven't voted yet. And when I say vote, take out Slido, I will stay in that lingo, because for this second plenary session, we'll be looking at a specific topic, which is all about the interplay between climate change and other environmental drivers on health-related outcomes. Now, that's a mouthful, but basically what we're doing is we're saying, hey, climate change is one subset of the environmental stressors that have an impact on health for people, for the planet, for animals, we want to focus in this session a little bit more on the broader sort of environmental stressors that are playing a role here. And again, as always, to do that, I would first love to hear from you. So if you can pull out Slido again, then I have a question for you, which is all about which indirect consequence of climate change do you think is the most important to human health? And the most important is, that is to say, has the most effect on human health. So do you think that biodiversity loss has the most impact? Water security, degradation, migration, something else? We also have an other category. So to those that don't fit the box, I would say eat your hearts out and vote for it. Now, while you fill this out, I'm going to explain what we'll be doing for this specific plenary session, because we have a bit of a twist to the format. In a little bit, we'll have our trusted stellar speakers that will do their presentation, but then at the very end of a presentation, they will end on a statement. Okay. And this statement can either be proposed or opposed by you. And it's very easy for you when we do the debate after the presentations to show whether you agree with the statement or whether you disagree. Because, and I'll repeat all these rules later on, so don't worry, don't panic. I see that man sweating there, thinking, oh my God, I'm not going to remember this. Don't worry, I got you. But after every statement, I'm going to ask you that if you agree with the statement, that you stand up. And if you disagree, you remain seated. As you can see, there's no room for nuance in this world. I love it, spicing things up. But just to see if you understood the rules of that game correctly, let's do a practice statement all together. If I would say that my statement is, I understand the rules of the game. So the game I just explained. What would you do? There you go, folks. There you go. Amazing. Big round of applause for yourselves, everyone. And to those of you that were on their phone and that were all of a sudden thinking, why is everybody standing up? Don't worry. In a little bit, we'll have statements. If you agree with the statement, you stand up. If you disagree, you remain seated. And I will find you even if you're seated, because this agreement is also very interesting to hear more about. Now, enough said. I see that the results of the Slido have come in, and I see that we have, whoa, a tie. Oh, no, never mind. Who did that? Come on, we had a tie. But I do see that it's sort of like a neck-to-neck race between water safety and security and biodiversity loss. That's actually very interesting and potentially something that our speakers can also tap into in the presentations that they'll give. And I'll say, let's just dive straight into that. So it is with great excitement that I can welcome to the stage our opening speakers for this specific plenary session. Please help me again in giving her the biggest round of applause. She is the director of the Department of Environment, Climate Change and Health at the WHO. Everyone, can I get a big big round of applause for Maria Neira. And Maria, the floor is all yours. You'll find the clicker there.
I don't know about you, but I love this Master of Ceremonies.
You're
I think
flattering
she's
me.
superb.
No. So sweet.
I think everybody agrees. Okay, this was a tactic to attract your attention.
Do you need help?
Okay, somebody wants to. It's okay, it's perfect. I wanted to. Thank you, doesn't matter. I wanted to attract your attention and making sure that everybody will be listening, so perfect tactic. Well done. Next time we will work together. Remind me to, the $20 later on. Okay, fantastic. Thank you very much, and I think I have controlling my time because I have several messages to share with you. First of all, I think what we hear until now was extremely important. And I think if we put the knowledge of this room all together in terms of how climate change is affecting our health, we have it. We probably have the best state of the art in terms of how climate change is affecting our health, missing this room, and therefore I'm not insisting on that one. On the contrary, I'm using the fact that we are all convinced that the climate crisis is a health crisis, that there is no controversy regarding the fact that climate change is having a very negative impact on our health. Therefore, I want to start reminding you, if I can, definitely there is a kind of, okay. I know that I will be a little bit provocative, but you don't need to do this to me. I mean, here we are. No? Oh, it's okay. Now? No. Well?
Okay, we're going to get to the bottom of this boycott, Maria, because...
Okay, I wanted you to remember my presentation, but not so much.
Green button.
Okay, thank you. Let me see now. Fantastic. No, my point is the following. We have all been working on environmental health for a while, and I wanted to remind you that when we tackle the causes of climate change, we are looking as well at the whole picture on environmental health. No need to remind all of you that 25% of the global burden of diseases, 25% of the global burden of diseases means almost 13 million deaths can be avoided. I know that many of you were looking for the reason, the mission, something that we will connect all the dots. Well, this is not a bad one. If we are able to look at all the environmental risk factors and all the diseases associated with that, diseases that are very much affecting the European population, the global population, ischemic heart disease, chronic respiratory diseases, cancer, unintentional respiratory infections, name it, all of those diseases could be prevented. What is happening is that now climate change is even undermining all of those environmental determinants of health and putting even all of us more at risk. But don't forget the global picture and the context in which we are operating. Definitely, this one, I think the science is there. Of course, we need to keep collecting more science, but no excuses not to start to do much more and starting to do the work that this research community has a huge responsibility to do. Normally, we can take maybe even the pleasure to do a lot of research, very specific, very specialized. I'm afraid on climate change and health, we need to go as quickly as possible on operational research, on research that will be responding to the magnitude of the problem we are facing, with the ambition that we need to respond to, and of course, with the speed that this huge public health problem is representing for all of us. And why? This is my first point, and I think has been raising here very strongly. The causes of climate change and the causes of air pollution overlap on a very significant way. And tomorrow, this week, a very important decision, an European directive on air quality will be approved or not approved. Imagine what that represents when we have today 7 million premature deaths occurring every year because of air pollution. So this research has to provide responses, as I say, with a lot of ambition, with operational research, with inspirational research, strategic research, to respond to those 3 transitions. Normally we do research to respond to specific questions. Here we need to lead the 3 transitions that are fundamental for our society to survive. The transition to clean energy, and I think the figures are extremely important. The transition to a sustainable food system. Clearly, 770 million people face hunger, and climate change will be accelerating, exacerbating, creating big problems, and again, putting the current state of food system, which contributes to the climate change, is very much at risk, and we need to do something about that. Of course, water security, and I think you hear it as well. We are having outbreaks of waterborne diseases, outbreaks of cholera. We need to invest on water system, and the good thing about the climate change is that if we tackle the causes of climate change, this can represent one of the most attractive, powerful public health agenda. So this transition has to occur as well. This gap has to be closed finally. And of course, we need to tackle biodiversity and the urban spaces. I hear you as well in another session talking about this transformation to healthy urban development. Biodiversity is all together, the One Health approach. We need to put all of those communities working together, avoiding those silos that we were talking about this morning. And this will require a very strategic and tactical approach among the different research communities. For us at the World Health Organization, you heard this morning a lot about the Health Day at the COP28. It took more than 10 years to reach there. You know that. It was not easy to infiltrate. Jeremy Farrar was talking this morning about the role of WHO inspiring. I will go even further, inspiring and infiltrating and influencing. And this is exactly what's happened at the Health Day at the COP28, making sure that 50 ministers of health were sitting there, more than 2,000 representatives from the health community, the signature of 40 million of health professionals attending. That means that we are really unstoppable if we work together. But is this enough? The 143 countries that signed the Climate Change and Health Declaration? No, we need to go to the next step. And for the COP29, we need to be even thinking bigger, more ambitious, and making sure that the negotiators will not leave the room, not only not knowing that climate change is affecting our health, that I think they know by now, but incorporating a way to measure their work on reducing emissions and maybe linking that to a health outcome, something that we all can contribute to monitor, to check, to put the indicator, something that will give us some reassurance that those efforts on the negotiations on climate change will be effective. Those are the 3 grand challenges on global health. And in fact, it's more than 3, but putting all together like that, those are the challenges we need to respond to. So starting by the end, if we look at the challenges, then we can decide which type of research we need. Those are the challenges. We need to make sure that we will address the range of health impacts of climate change, obviously. So we need to respond to all type of infectious diseases, non-communicable diseases, climate-sensitive diseases, having epidemiological surveillance systems that are looking at climate-sensitive diseases, having a vulnerability assessment in each country, making sure that the vulnerabilities, the equity issues are addressed. And for that, we will need a research that will be responding to all of those questions. We need as well to strengthen the climate resilience and the environmental sustainability of the health systems and facilities. Many of you probably will be in Madrid the first week of March, where we will have the meeting of ATTACH, the Alliance for Action on Climate Change and Health, Transformation on Climate Change and Health, where we will be looking at how we can make sure that our health systems are resilient and how we reduce our own carbon footprint. This will request some monitoring, some making sure that we are all moving in the same direction with the research that we need to respond to all of those questions. And the third pillar, which is extremely important, the mitigation one, is the one that can be our best tactic, the one that can be positive. We need to use those health benefits. I'm sorry, but I refuse to call it co-benefits. I know that in theory and from a very scientific point of view are co-benefits, but we need to use it as benefits because those are the most powerful arguments we can use to accelerate more action and to make sure that we are not missing all of those challenges that we have in front of us. What is the WHO role? I think you know it by now. Many of you have been working with us and defining all of those priorities. So leadership, capacity building and country support, evidence and monitoring, and I will add another function that we need to all of us accelerate, which is the climate financing. As mentioned by the Ministry of Health Malawi, very little resources are now going to the health system coming from the climate financing mechanisms, and those climate financing mechanisms are still more on the narrative rather than on the implementation. So we need to add all of that as well. And then inviting you to, again, many of you are already part of this, defining the priorities. We have created this group called REACH, Research for Action on Climate Change and Health, is the agenda that will define the priorities on climate change and health, the agenda that will look for the overlap with the air pollution, where we can have more impact, where we will be defining the answer to all of those questions and making sure that it's an operational, quick agenda and where the whole scientific community will feel well represented, responding to all those questions, obviously inclusive, modular, through a platform, and laying the ground for regional and national research agendas. Of course, mitigation, adaptation, and of course, top-down and bottom-up. Both approaches are extremely important. We cannot leave in the hands of the communities to look at how to transition to new clean sources of energy. We need to do that at global level as well, influencing those who will have at the government level the capacity to respond. I'm looking at you, I'm okay? Yeah, more or less? Well, in fact, yes, I'm okay, because I think that will be my last one. So again, it was a rhetoric question. Thank you all for your attention, and we will look at my statement later. Thank you.
Round of applause. But stay with us. You can stay with us. You were more than okay indeed. I didn't know that was the final one. And maybe if we go to the next one, you are okay, but let's see if the room is okay after we have this debate. Because, Maria, you have brought a question along with you. There is a bit of an elaboration underneath it, but the main gist of your statement is the persistence of funding for fossil fuel use reflects a contradiction in our global agenda. You said that you like to provoke the room. I love this statement. So, folks, I will say, if you agree with this statement, you stand up, and if you disagree, then you remain seated. And now we're going to see what happens. Okay. And I will say, freeze! Everybody stay where they are, because this is the point where peer pressure kicks in. No, you cannot sit down if you were standing up. I have photographic memory, and I know each and every one of you by face and heart. Maria, I'm going to go in to see what they say, because there are some people that are standing up. Let me check. Oh. Hi.
Hi.
You're standing up?
Yes.
Why do you agree with the statement?
Because it's complete contradiction. I mean, we keep spending money on fossil fuels in obviously in technologies that are not sustainable, and it's money wasted.
Okay, so you would say indeed that it does go against. So you agree with Maria? That's interesting. Thank you for sharing also. But I see that just 2 rows behind you, there is somebody that is stubbornly still seated down. Would you like to stand up and say who you are? You're standing up now, but you're seated down, so you disagree with the statement.
Yeah, so I'm Tim Taylor. I'm from the University of Exeter, and I'm an economist, so you can boo me. But I think it just shows that the global agenda really is to do more with increasing GDP and possibly reducing poverty through that, rather than focusing on climate change. So there's a fundamental need to change the global agenda, is what I would say.
I get it. But it's almost, you're almost putting a bit of a philosophical lens on it. You're saying, no, it's not contradicting our global agenda, because let's define what that global agenda really is. And I think that it's one that is really made to drive economic growth in that sense.
That's right.
Okay, thank you for sharing that. Maria, if you want to respond at any point, please feel free to do so. Is there somebody, by the way, in the room that has a perspective that they're like, well, this should really be heard because it hasn't been mentioned yet? You're all so humble. I'm sure there's a mastermind amongst you. Okay, then I'll allow you to respond.
I fully agree with our economists. What we are doing by tackling climate change is tackling the causes of poverty as well.
Yeah.
You have $7 trillion every year going into subsidies to fossil fuels. With that money, we could certainly cover the universal health coverage for a big proportion of those poor population. And the price we are paying is not just those subsidies. We are paying the price of people being at the hospital, the health system's paying for the treatment of those chronic diseases. So it's a huge contradiction in terms of, in addition to that, I think tackling the causes of climate change and air pollution, for me, is the most common sense poverty agenda.
Yeah.
But maybe I'm wrong. I'm not an economist. I'm only a medical doctor, you know.
A medical Sorry, that's just a punchline to any economist. I'm not an economist. I only studied so long, and I'm a medical doctor. And no, but you're right. And I think, actually, thanks for your perspectives as well, because it's interesting, because then the question remains, how do we change the agenda, right? The global agenda, and how do we make sure that it actually underlines the values that we say that it should? I have also received some comments on the chat. You mentioned it will be important that COP negotiators understand the health threat climate change poses. What are your hopes? What should negotiators agree on? Sparked some curiosity there.
Well, definitely, more than a hope is a huge ambition. You know, when you work on public health, your level of ambition shouldn't have limits. So I don't have any limit on the ambition for the negotiators of the COP29. 29 years negotiating is a little bit too much. So maybe now that they have discovered the health day, we can go quicker by bringing the health argument, which in our opinion, the opinion of many people working on health, is probably one of the most powerful.
Yeah.
So huge ambition.
Yeah, I love that,
Definitely.
Honestly. Can we once more get a big round of applause, everybody, for Maria and Neira for starting that off with us. Thank you so much. Thank you. And I think that was an interesting one, not just because of the stats and the figures and the information you shared with us, but also because I think in its core, you're also talking about a paradigm shift. I mean, you did so when you said that you refuse to call it co-benefits. It's benefits, but that is fundamentally about changing the way in which we look at things. And only if we do that, we can make sure that we truly are, as you said, living up to an agenda that actually reflects the values that we hold dear. Thank you so much, Maria. We go over to our next speaker. So again, I'm going to ask for your enthusiasm in helping me to welcome the following speaker. He's the director of the academic program in exposure assessment and human health effects. Please give it up for George Thurston from NYU Grossman School of Medicine. There you go. If that doesn't work out, maybe I'll give that to you.
Okay, simpler. Well, thank you. Let's see. Go forward. Went 2. Okay. So today I'm going to talk briefly about PM 2.5, and we were asked, environmental stressors related to climate change, and I'm going to talk about particles in the air, and then about the human health benefits of transitioning away from fossil fuel burning. I think probably most of you are familiar with PM 2.5, but I'll just briefly say it's fine particulate matter, very small particles, less than 2.5 microns in diameter. Human hair is about 70 micrometers in diameter. And combustion particles are part of that. They're generally submicron, around 0.5 or 0.6 microns, which is the same size as the wavelength of light from the sun. So they're very, very small, and they go, when you breathe, they go deeply into the lungs, and they can go systemically, and so they can have a great deal of health effects. So as Maria said, 7 million deaths per year associated with air pollution, and most of those effects are from ischemic heart disease, and 34, most of those effects are from long-term indoor PM 2.5, the air pollution deaths. And that's basically the same sources as we get very much of our CO2. One of the things I wanted to say about this was that earlier a speaker, one of the administrators for the EU climate plan, a green energy plan, was saying, well, yes, it'll be expensive, it'll cost, but he viewed it as an investment. But I think it's more than that, because we're really paying right now costs. In other words, when we're breathing pollution, we're paying extra energy costs when we're breathing this pollution. And those costs will be avoided if we switch to using things like solar panels. So when a person puts solar panels on their roof, they're going to save energy costs. I know my electricity bill went from hundreds down to tens of dollars per month when I put up the solar panels. But they're also improving health, saving lives when they do it. And I think we need to remember that. So, the whole thing, and I'm pointing this out, the air pollution and climate change are two sides of the same coin. In other words, the sources that cause climate change, cause the pollution that causes climate change, largely CO2, comes from the same sources and in this study, they said a quarter of all health-damaging PM 2.5 is from fossil fuels. Now, that's a lot, but I have to say, I think they're underestimating how much fossil fuels are causing adverse health effects. This study and the studies that people are doing, and so, we talked earlier about saying, well, we need scientists who can talk about policy. Well, I'm going to do that, so see how it works out, okay? But the way that these studies are done is they use the weight of the particulate matter, and they relate the average effects of PM 2.5 mass on adverse health effects. So this means that we're not considering the variability in the toxicity of these particles and treating them as if they're all the same. So this is the average. This study uses the average of the toxicity of PM 2.5. And most of the studies you see out there, that, as a matter of fact, every one I've ever seen does this. In other words, they don't look at the particles depending on their composition or their source especially, and say that they have different toxicities, different composition. And we need to recognize that because we're really missing a lot of the adverse health effects of fossil fuel pollution. A study that I did in 1987 with Luke Oskanek was the first study looking at PM 2.5 and mortality. We called it FPM, fine particulate matter back then. And we looked at fine particulate matter versus inhalable, and those are larger ones that can just barely get past your trachea, or total suspended particulate matter. And that was actually, when we were doing this study, that's the way people measured particles. They just had a filter and a pump, and they collected air, and they said, okay, this is what the filter weighed before versus after, and that's how much it is. And it considered all particles. So this study, and basically what we found in the study was that fine particulate matter were much more toxic than inhalable and more toxic than total suspended particles when you collected them. And our overall conclusions were the results from the various analyses indicated the importance to considering particle size, composition, and source information in the modeling of particle pollution health effects. Now, the first part of looking at particle size, eventually, the regulators figured out, and there were other studies that followed this, Six City study, American Cancer Society study, that found very similar results in a more rigorous way. They had cohort studies and the like. But part of this study, we also looked at, I used a technique that I developed in my dissertation work of doing source apportionment. In other words, how much of the mass was coming from different sources based on fingerprints. And those fingerprints were like trace elements. Back in those days, automobile emissions could be traced using lead because we added lead to gasoline. And so vanadium and nickel for oil, and selenium, sulfur, arsenic for coal. And what we found was that, let's see where the pointer is here. I think, is that the pointer? Well, not sure. Here. And what we found was the really significant driver was the coal pollution, and that the coal's coefficient of effects, and that's in terms of deaths per 100,000 per microgram per meter cubed, was 5.77 versus 2.9 is what we found for the overall PM 2.5. So basically, what we found was that coal particles were roughly double the toxicity per microgram as just the average. And by the way, the average included the coal. So they're even more than twice as toxic as the other particles. Then we followed this up years later using the ACS cohort. And what we found was that coal and traffic particles per unit mass, the overall, the average, the number that it tends to be used in policy analyses, about 4% per 10 micrograms, whereas traffic came out 8% and coal came out 14%. So 2 to 3 times more toxic per microgram. Hope I'm not getting too far in the weeds. This is another study that was done using the Medicare cohort by another group, Helen Sue's group at Tufts in the States. And they found that traffic was about 1.5 times the overall, and coal was about 2 times. All right. Oh, what did I do? And then I just don't want to leave out a European study. The LAP study similarly found the strongest associations with traffic, and the highest effect per microgram was residual oil related. So what we're seeing is, across these various studies, that the particles coming from fossil fuels are at least 2 times the effects. And this is a study, maybe I don't have time for this, but we looked at, someone was saying, well, we need our interventions, right? This is where they closed a coking plant in the States, and we published this. And here's cardiovascular visits sort of rising, and here's what was predicted. And this is the day they closed the plant. And it dropped the admissions, the visits, emergency department visits for cardiovascular disease, dropped by about 1/4 and then just kept going down once they closed that plant. It's a very strong effect. These are very potent particles that have large health effects, larger than people give them credit for. And the reason is because they have these toxic constituents, sulfur, arsenic, and it causes oxidative stress. I won't get into the thing. So basically, that's my point is that when we're looking at the health benefits of taking action on climate change, and by reducing, if we can transition off of fossil fuels, it'll lead to a healthier humanity. Thank you.
And if you'll stay with us for a minute longer, we of course have a statement from your side as well. Before we go to the statement, and we're a little short on time, so I will ask you to be your most succinct version, because there's a question from Colin before we go to the debate, which I do think is an interesting one. He's asking you specifically, the source of indoor air pollution is often domestic solid fuel burning, which in developed countries is often optional. How to generate behavioral shift. But I think it also taps into something more deeper, into what customs are around the world and how do we make sure that we also get everyone along in that journey.
Well, yes, indoor air pollution is a significant problem as well. Here I'm speaking about outdoor air pollution and the measurements, but indoor is also a contributor. And depending on the fuel that's used and the ventilation is very important. But transitioning off of burning solid fuels is a very important step that we have to work towards, especially in the developing. I've done studies of women working all day long with their kids with them and getting exposed to these high levels. Like in India, where it just rains all day during the rainy season and they're stuck inside and breathing this pollution. So it's a major priority, as well as outdoor air pollution.
Right, okay, so there's still some attention needed to how we ensure behavioral shifts. You brought a statement with you, which is right behind us, and I will read it again, and I'll allow you an opportunity to oil those knees, to sustainably oil those knees, I should say, I'm joking. The statement you have is, as we transition away from fossil fuels, we will transition towards a healthier humanity as well as a healthier planet. If you agree with the statement, please stand up. And if you disagree, remain seated. And I will be on the lookout for people that might disagree, and they're here. Okay, everybody, freeze! Freeze! Don't sit down if you're standing, and don't stand if you're sitting down. And there is somebody that has caught my eye. Hi! If you'd like, could just stand up and tell us who you are and why you disagree. I'll hold it for you.
My name is Martin Sroma. I'm from the University of Leiden in the Netherlands, and I don't think I necessarily disagree with this idea, but I do know that fossil fuels have resulted in sort of the global population as we know it.
Right.
And I'm not so sure if we have an alternative model to feed all those people on the planet without fossil fuels. But at least not in the healthy state as they are now.
Right.
So,
I see you nodding.
I see
faces.
some issues with this.
George, would you like to reply? Thanks, by the way, Martin.
One of the things that I'm careful to say is the combustion of fossil fuels. Certainly, I would not want to say we couldn't use fossil fuels to make medicines or, for food, feeding food. It would be a transition. We're talking about a transition here. We're not talking. I think that too often people say, well, the whole economy will come to a collapse if we do this transition. Well, obviously, you are not going to do that all at once. It takes some time, and people are talking about a transition. And the most obvious, of course, is our electric generating grid to convert that over and get other sources of energy that don't involve fossil fuel. But I would say one of the goals we talked about at ATS workshop recently and proposed is that we should work towards having combustion-free homes and buildings.
I feel like I'm doing a sneak attack on you. I don't know if you've noticed me yet, sir. You've noticed me. Would you mind to stand up as well? Because I saw you were nodding when Maarten was talking, but initially you stood up. Did you change your mind or?
Well, it's healthier. It's not healthy. I mean, it's improving, but we're going to have a lot of other challenges to face.
Right.
Which is something that I agree with.
Yeah, but you would still remain with your point because you still think it outweighs the overall. Okay. Yeah. And the challenges we're facing?
Well, the World Economic Forum has talked about the severity of the misinformation, disinformation. We're talking about politics. We're talking about terror. We're talking about other issues which we have to face.
Right. Especially in the transition that we make with change always. Thank you. Sorry for sneaking up, but thanks. I'm happy I did it. Okay, thank you so much. As time flies, as they say, when you're learning new stuff. George, I want to thank you incredibly. Is there something you would like people to keep in mind when they go into tomorrow's program? Because, of course, you chose this one as well. I think, I don't want to fill it in for you, but I think it paints a picture as well, right, of where we should be headed towards.
Right. I think that we have to look at ways that we can improve humanity at the same time as we're helping the planet. Part of that is just the way people think. If you look at the polls and you say to people, well, do you think this is a top priority to save the climate and climate? It's not at the top. But what is up there is, what about the health of your family? Health is an issue that cuts across and avoids a lot of these political battles that even no matter left or right, wherever, health is a unifying message, and I think that's going to be the most successful. And also it makes dollars and cents.
Fair. Also, it does. Can we have a big round of applause once more, everyone, for George Thurston? Thank you so much. Thanks, I'll take that. Thank you so much. And also thanks to all of you for participating. We're going to go on quickly because, as I say, we're racing through time. So I'll hand over quickly to our third speaker of this plenary, all the way from Norway, from the Center for International Climate and Environmental Research at Oslo. She is research director there. Help me in giving a big hand to Kristin. Aunan, everyone. And I will give you this one. Thanks. Yeah, that also works. Would you prefer that? I'll take it.
This nice introduction. I feel I'm in a NBA basket. Let me see. So thanks a lot for having me. It's a great opportunity to speak in this conference. It's so many people with a lot of knowledge, and I feel quite humbled to stand here. I will share some reflections and some main outcomes from research we have been doing the last 4 or 5 years. And I will particularly speak about the interlinkages of ambient heat and air pollution and the associated health risks. So as we have heard many times today, there's a close link between climate change and air pollution. The same emission sources. So if we abate greenhouse gases, in many cases we will also abate air pollution. Of course, there are also individual impacts of heat stress. We know it leads to premature deaths for many different diseases. And also air pollution has large impacts, the largest environmental killer, actually, currently. But unfortunately, there are some important mechanisms that work to amplify the health impacts of heat stress, climate change and heat stress, and air pollution. And some of these mechanisms are working in the atmosphere. So climate change and increasing temperatures very often can worsen air quality, and particularly when it comes to ozone and particulate matter. So, for instance, photochemical reactions are speeding up when it's hotter, creating secondary pollutants like this ozone and particulate matter. There might be stagnant conditions that trap the air pollution, so prohibiting venting. And also emissions may increase. And very different types of emissions, anthropogenic and natural emissions, may increase. But here I will focus particularly on the effect on wildfires. The fact that increasing temperatures and droughts leads to increasing risks of wildfires and associated air pollution. So that's what's going on in the atmosphere, and then we have what's going on in our body. And unfortunately, there seems to be an increasing number of studies, including our study in the EU project Exhaustion, that shows that there is that heat and high levels of air pollution have an interactive effect on health, particularly for vulnerable people. And we are looking particularly at respiratory diseases and cardiovascular diseases. So back to the first, what's going on in the atmosphere. This is a figure showing the blue line. The blue line here shows actually the fantastic successes of European air quality policies the last decades. So air pollution has, particularly air pollution in this case, has been reduced over many years. This figure shows the excess deaths from PM 2.5 exposure. This is work in progress by colleagues here and in Finland. The Finnish Meteorological Institute is our partner in this work. So it basically shows that we have done a lot to improve the health of Europeans. But then comes the red line, which unfortunately is the increasing emissions from wildfires that is counteracting the successes of the air pollution policies. The figures are low. The axes are very different, as you will see. But still, there's something going on that is worrisome, and we have to understand how this develops in the future. We have done some preliminary, or we are working on this, but I would say that there is still a strong need for improving modeling and forecasting techniques to predict air pollution from wildfires. And not the least, I mean, one thing is fire weather and what goes on with emissions, but there's usually a human being who ignites the fire. And why? How is that working? What are the social factors or the environment and the way we protect our forests, forest management, and all the other things that is not directly related to the climate, but can increase or decrease the risk of wildfires spreading and really impacting air pollution. We have already discussed the different toxicities of particles. There's still a lot of work to be done when it comes to particulate matter or emissions from wildfires. What is the toxicity? What is the size distribution? What is the chemical composition? Are they more toxic? Are they less toxic? There are some indications that they are more toxic. For instance, there's one study showing that the hospitalization for respiratory diseases is much higher when there's wildfire particulate matter. But this is still very uncertain, so a strong need for research here. So this is the other what's going on in our body. This is an illustration from our project where we say something about the interaction or the fact that air pollution modifies the heat-related mortality. So this figure is for lung diseases, and it basically shows that when there is a hot day and we have increased heat-related mortality during the hot day, if it is low pollution, we find a 10% increase in heat-related respiratory deaths in this case. When the air pollution is high, simultaneously as we have a hot day, this is daily mortality, we find that there's a 20% increase in heat-related respiratory deaths. So there is an interaction effect. So what does it mean? I would say that this means that with air pollution reduction, obviously reduces the pure air pollution health effects, of course, but it's also, we can look at it as an adaptation option, because we have also calculated that 150,000 heat-related deaths can be avoided in Europe over the next 25 years if we quickly meet the WHO air quality guideline, instead of keeping status quo. So that means this shows the importance of mitigating air pollution also in the context of heat-related deaths. So we find evidence, strong evidence for interactive impacts of air pollution and heat stress in Europe. Europe is, after all, not that hot, it's not that polluted. So what about other areas of the world? So what are the hotspots outside Europe? And here, some of you have already mentioned the issue of household air pollution. And we think that there is a strong need to study this in the developing countries. Co-exposure to heat and air pollution is an unexplored issue in these countries with potentially large impact on health and economy, both for disease but also for workability. They have tropical climate, local enhanced air pollution, tons of maybe highly pollutant vehicles, etc. And people are doing hard work outdoors without any worker protection or regulation. So this is an unexplored issue that I really think is important and can have large consequences. Finally, we need to mitigate or stop emissions of greenhouse gases, but we also have to realize that we are now passing 1.5 degrees, we are heading toward 2 degrees, so we need to adapt. And early warning systems is an important mechanism for adaptation. And in this NMBEL project that we also have been running, we have looked into what are the requirements for these systems to actually work. And we find that it requires high-resolution data, so coming back to the need for high-resolution data, both for health and for climate or environmental factors, long-term funding, training, and technological infrastructure. We need partnerships and co-design with local communities, data providers of all sorts, users, to ensure that services align with user needs. Effective communication is extremely important to ensure equitable access to climate services, to reach the hard-to-reach groups and the vulnerable groups. They're often the same. And finally, evaluation of benefits obtained from the use. We need to understand what are the costs of this system, what are the benefits, short-term, long-term. And I finally just encourage you to have a look at our websites for the Exhaustion and NBER project. We have produced a lot of knowledge products, very easy to read, fact sheets, policy briefs, a white paper summing up the results. So I encourage you to have a look at that.
Thank you so much. Can we have a big round of applause, everyone, for Kristin? Thank you so much. Thanks. Now, if we go to the next slide, we have to do a little disclaimer for this statement, right? Because I love your energy, Kristin, especially when we go to this next one. The statement you prepared, it also had your own opinion in it. So I loved it. I was reading it and I went, no adaptation strategy can give the same benefits for health as mitigation. I thought, oh, that's a nice statement. And then I read, but we no longer have the luxury of choosing. Mitigation and adaptation needs to go hand in hand and with health as a driver. So then you already know the position of Kristin, but still to see what the room thinks, I want to propose the first sentence as a statement to see where you stand. So the latter bit, that is just general extra information from Kristin's side. But the statement is, no adaptation strategy can give the same benefits for health as mitigation. And I know that there are going to be people that are going to say, that's such a false dichotomy. Why would you present me with that? But c'est la vie. Remain seated if you think that that's the case, and tell me by raising your hand. But then I'll say, please stand up if you agree with the statement, and remain seated if you disagree. Now, this one is a little more controversial, it seems. Ooh. Okay, freeze, everyone, because at some point peer pressure kicks in, and then if you let people think for long enough, everyone will stand up when all the neighbors are standing. But if I may sneak just behind you, sorry. Thanks. Hi. May I ask you who you are and why you're standing?
I am Esperanza Diaz from the Pandemic Center. Of course, if we could go back, it could be much better. We cannot, as we have already seen it. But yes, so I agree with that.
So, okay, you think that the prevention potential of mitigation is so enormous that...
well, probably.
Yeah.
Yes.
Okay, but it's more of a almost time sort of eliminating thought experiment that you're doing.
It's too late for that.
Yeah. Okay. So what would you say now? Would you agree with the latter part of Kristin's statement?
I think that's quite easy to agree with.
Okay. Yeah. Okay. There you go, Kristin. It's easy to agree with. That's a good one. I see some other people standing, but also some people sitting. Sorry, I walk right past you. But who are you, and why do you agree?
I'm Magdalena Skipper, Editor-in-Chief of Nature. You highlighted the first part of the sentence. It's impossible to unsee the second part, and the lady over there already said it.
Yeah.
It's impossible to disagree.
Yeah.
That's where we are, unfortunately.
Yeah.
We no longer have the luxury.
And maybe if I can sort of like provoke you guys a little bit, the people that are standing. In 20 years' time, the same argument could be made, right? Even though we have climate change that inevitably will. I mean, we already have it, that we won't be able to turn back around. But I hope not. But perhaps it's just a whim of, no, I can't say that. Where we'll be in 20 years.
I think for me to disagree with the statement, you would have to give me more than 20 years. I'm usually an optimist, but I'm also a realist.
Okay, that's interesting. Okay, thank you. Thanks. Sir, you're seated. You say, oh, no, that's okay, but are you seated because you disagree, or?
No, for me, I don't need this first part of the sentence.
Ah, okay, why not?
You don't need it. You don't need to bring adaptation and mitigation against, even if you say the second part. If you have to say second part, you don't need to emphasize the first part. We know that we need to do something about adaptation.
Right.
We call that people do again more for mitigation. That's it.
Yeah.
It's not saying again, no, adaptation doesn't do. For me, this is not a constructive sentence.
Right, I like it.
She doesn't need, or he doesn't need this first part.
Yeah, I put it in just so I could find somebody like you to talk to.
Thank you.
So thank you so much.
Yeah.
Thank you, everyone. Did somebody want to? Oh, you agree with him. Yes, amazing. Okay, thank you so much. And can we once more? No, sorry, Kristin, do you want to respond to any of that?
Yeah, no, but I mean, I think the first part of the sentence, it's about the urgency.
Yeah.
If we really could speed up the mitigation, there are so many benefits related to mitigating.
Yeah,
so
but we brought ourselves.
It would be a different world.
Yeah,
but
yeah,
it's
indeed.
Too late.
Yeah, indeed, we need to do both. And indeed, I liked what that gentleman said. False dichotomy. They're not. It's not a zero-sum game between them. I like that. Can we once more have a big round of applause, everyone, for Kristin? Thank you so much, also for bringing that to us. Now we're moving to the fourth and final speaker of today. Once more, I will ask you to help me give him a big round of applause. He's a chief scientist from the European Food Safety Authority. Give it up for Carlos Gonçalo das Neves. Do you want a microphone, Carlos, or do you want? Yeah. There you go.
Thank you very much, and a very good afternoon to everyone. So my colleagues at the Commission challenged me a little different, perhaps, from some of the previous presentations, to tell you in 7 minutes and 5 slides why One Health as an approach could also work in this connection between environment and health. At least I know I have an audience of believers, so that they are connected, we no longer need to discuss. But I still thought it was important to give you a practical example on this happening in real time. And since you invite the chief scientist of the Food Safety Authority, I don't think you'll be surprised that the best example is food safety. I knew in Slido I got the bronze medal, but behind biodiversity and water, but food safety works. It is a common thread connecting health, climate, and we know it intuitively. We know the importance of safe and nutritious foods. We know the impact of infectious diseases through foodborne diseases. And we are aware that food productions are both a driver for climate change. We know the impact that it has on climate change, but we are also, even in Europe, getting more and more aware of the impact of climate change in the capacity to produce food. And if you don't believe me, look at the World Economic Forum, because that's everyone around the world saying what are the 10 biggest threats in front of the planet. And I think even for the AI, I think I can connect food production and food safety to all of those challenges. And it's not out of scope that the first 4 are actually on the environmental area. I should do here between brackets, since I'm an infectious disease guy as well. It's a little scary not to see pandemics and infectious disease any longer on the top 10, but let's hope it's just a caveat in the system. Anyway, this is complex, but it doesn't need to be complicated. It is possible to see it in action, and let's jump into the water for once and not stay in land, and give you an example, a practical example we've been following as we monitor the impact of climate change around food production systems. Here an example with the production of a cetotoxin. This is produced by algae, it gets into the fish, it becomes food, it can have an impact in humans. And we've been following this together with our Spanish colleagues. I think, Maria, this must have been the time from you were there, perhaps we started then. Anyway, an example of something that is spreading due to climate change, and we need to assess and provide support to manage on the risk of these events. And it's easier already here to understand that this is not just about the toxin, the fish and the person, because here we have biodiversity in play. We have to do climate change, the variability of the fishes that may be affected, how far the algae will be produced, how many people will be exposed. So risk assessment is also getting a little more complicated. It's complex, and like I just said, this time, it can be complicated. But we can no longer do it without bringing the environment. And this is what we would call perhaps a paradigm shift, the way we do risk assessment, when we really move into environmental risk assessment, when we bring those components into the traditional approaches we've had. And it's also a challenge because the environment is changing really quick. Some of my colleagues helped me to put there a few examples of things which are happening in real time on the upper shelf. I won't go into the details, but the range of vectors, the different types of non-target species, all of them can have an impact in how we do the risk assessment. We may have to change methodologies. We may no longer have the needed data. We may have to redefine specific protection goals because, to give an opinion if it's safe or not, you need to tell also how willing are you to make it safe. So a lot of the parameters we will be using to do risk assessments in real time are changing really quick. And this brings me now closely to the One Health. This means that for this to work, it's no longer just having the risk assessors on the table. We need people here quickly translating science into usable products for risk assessors, whether it's methodologies, model tools, data sets. The science needs to be even closer to, in this case, risk assessors. And this was a drive for Horizon Europe, and I would say a drive that I hope will continue to FP10. Science needs to close the gaps we have in many regulatory areas so that we are able to provide managers, policymakers, the sufficiently grounded scientific information they need to take decisions. But we need also more than just scientists, because we've talked here already about data. Data that very often in the case of food is in the hands of those producing it, the private sector, the companies, how to share this in real time. So all of these need now to come around into the business, if I can say it, of risk assessment. And this shift means that we need One Health. And unlike the traditional Venn diagram, sometimes I'm already allergic to the Venn diagram and we use it a little too much. But I want to tell you that, okay, it's true, it's the animals and the environment and the humans, but this is also One Health. The connection of these four pieces of puzzle, or these four silos, if you want. And I'm not so sure I want to destroy the silos, but if they could be connected, we would have come a step forward. We need, as I mentioned, an engaged private sector that shares data, that engages in these game-changing days that we live. We need the risk assessors, as I mentioned, and the scientists even closer together. I have a long list of scientific gaps that makes impossible to have good methodologies, good guidances. I need your help, the help of all the science beating hearts of Europe to do this with us. We need, of course, political and management support. This means that those in power will have to have the time, the courage, the will to make change, sometimes regulatory change, legislative change. But I finish with the last piece of the puzzle, which is society. Let's not undervalue the importance of all of us in this change towards the future, a change that depends a lot of our own initiatives as well, as citizens, as consumers, as patients, as citizens. I measured that four pictures just to say that One Health has been a long, long time in the discussion, in the academic discussion. Slowly we've been moving from discussion to action. Big recognition here to some of the initiatives from the United Nations organizations with the quadripartite for One Health. Here also a picture from when last 1.5 years ago, the 5 agencies of the European Union working closer to this topic got together here in Brussels, 2,000 of us, to talk about One Health. And just last November, the launching conference for the Commission on how to bring One Health further into EU policy. And just so that I leave you on an optimistic note, we're actually making One Health into action. And indeed, the 5 European agencies working closer to this, the Food Safety, the Medicines Agency, the Chemical Agency, the Environmental Agency, that was here earlier with Len as well, and the Center of Disease Prevention and Control, came together on a One Health task force, which is slowly highlighting now possible areas of action from capacity building to even doing risk assessment together. And we are actually now looking into one specific cause, azole, so it's a fungicide, both used in agriculture and in humans. And the 5 of us together, for the first time, will not produce 5 risk assessments, one for food, one for humans, one for medicines, one for the environment, but one single product to the Commission. It's a game changer, we hope. Thank you very much.
Thank you so much, Carlos. Do you know you're perfect on time, like on the dot? Was scary, was perfect. And that means that we have a statement as well. I think if you...
I can put the rest of the statement.
Yes, indeed. That will. So now we're going to have to read in English and in SDG. Who knows how to speak SDG? I'm joking. So your statement is a holistic approach linking food safety to, I'll say, health and well-being. And climate action will enable the European Union to achieve global sustainability both on life below water and on life on land. Do I say that correct?
Correct.
Amazing. And I love how you're specifically talking about a holistic approach here, because I think the report that you just mentioned, the assessment where you're making one collective, that's the embodiment of that, right? You're living it.
Correct.
Okay. So is that...
Or trying.
Yeah. Is that how you would also define a holistic approach for this statement, just so people can get it?
That's what I'm trying to say, that the approach, I mean, this holistic view, this connecting people, connecting ideas, disciplines, way of working, that's what we would call One Health.
Okay, amazing.
Though there is an official definition, I should say.
No.
I'm looking at WHO in front of me. There is an official definition.
Okay, that's a good point. Your colleagues, that's amazing. Well, folks, you know the drill at this point. Read the statement if you agree. Stretch those legs, and if you disagree, remain ever so seated as you are. So the statement is a holistic approach linking food safety to health and well-being and climate will enable the EU to achieve global sustainability both on life below water and on life on land. Those that disagree might say, is that sufficient? I don't dare say that. Oh, probably not. Oh, Carlos, do you agree with the statement? Okay, he agrees. Well, I am curious to hear from some people. Freeze, by the way. Okay. Sometimes I'm just searching for people that avoid my gaze because it makes it extra fun. Now all of a sudden everybody's looking at me. No, I'm joking. You're still seated. Would you like to stand up? Maybe tell us who you are and why.
Hello, I'm Flavia from Italy. Not allowed to take it. So I agree with the idea that we should link food safety to achieve goals, but I think it shouldn't be only food safety. And if we only think of One Health around food safety, we might be missing out on other elements.
Okay, thank you. That's quite clear, succinct. Carlos, a short reply to that?
Yeah, I mean, I totally agree. Where you see food safety, you can replace with whatever other area you want to focus on. I made a case on food safety. But someone voted for biodiversity, someone voted for water security. I think it fits there as well.
Okay. We have somebody else here in the back. Could you tell us who you are and why you agree?
Yes. So I do agree that a holistic approach to linking not only food safety, but also our health and the environment will lead to global sustainability. So yeah, I agree with this.
Yeah, just straightforward the way that it is. It's a good example, and we can apply it to other instances as well. Okay, thank you. Hi. Were you just tired, or do you disagree? Okay.
I mean, I agree with the premise of a holistic approach is necessary. I just think the role of the EU is maybe being overinflated in this. If we're saying to achieve global sustainability, I think you need to involve all global stakeholders.
Right. Oh, that's actually a very fair point. Is that would you agree with that? Is that a caveat we found there in the statement, Carlos, or how do you look at that?
I fear. Oh, I'm not a fear. I'm happy that all the opinions have been to enlarge the statement, more topics and bigger than EU.
Yeah.
I don't have the mandate to go that far, so I'm staying home. But it's impossible to disagree, I think.
No, okay, fair point. But you do keep us sharp. Thanks. What's your name and where are you from?
Ewan from Wellcome Trust.
Okay, amazing. Thank you so much. Thank you, everyone. You may all sit down again, and I indeed do a big round of applause for yourselves for all the good participation and for Carlos. Thank you so much. Thank you so much, Carlos, for everything. And I mean, I'm not going to do a better summary than you just did for yourself. Everybody agrees it just needs to be bigger and like a more widespread statement in that sense. So they want to see more of it. Now, everyone, that already brings us to the end, unfortunately, of this plenary session. You were all amazing. Thank you so much for participating. Also to all the people online with their questions. In a little bit, we will have some parallel breakout session, but it is good to mention that after that, there is no plenary program anymore for today. So this is the last bit where we'll see each other. So dramatic, but luckily, we'll all be back here tomorrow at 9 sharp, so make sure to be here on time. Now, in a little bit, we will have a couple of plenary sessions that you can attend. If I'm not mistaken, we should be able to pull them up behind me, because if you want to follow a plenary session or a parallel session on health and sustainable nutrition in a climate change scenario, please go to the Jenkins room. If you want to go to water-related health risks from climate change, please go to the Manshold room. And to hear more about the combined effects of pollution, climate change, and biodiversity in human health, you can stay in this room. One final thing that's important to mention: after the parallel breakouts, we will have cocktails and walk-in dinner in the foyer there. You don't want to miss that, and you don't want to miss that announcement, so spread the word to your friends that aren't paying attention or aren't here. And then we'll see you tomorrow. Once more, a big round of applause for yourselves, and thank you so much.